Welcome back to Kentucky's Voice. I want to remind our listeners, if they want to catch a rebroadcast of this, they can go on YouTube or Facebook. There is a live stream on the Kentucky's Voice channel on Facebook or on YouTube. Just do that search. Be sure to like and subscribe to those videos if you want to watch this. We also will rebroadcast this on local TV if you have Spectrum, Channel 21, at I believe 12:30, 4, and 8 today. So check that out if you want. We are joined again by State Representative Steve Doan from District 69 in Northern Kentucky. In the last segment, we talked about two common sense pieces of legislation. Let's allow the public to use some of the school facilities that they fund and finance for just recreational activities. For example, allowing people to use the school track when the teams are not using that. We also talked about the chicken bill, allowing people to raise a small number of chickens in their backyard so they can produce eggs and basically teach their kids where does that food that they get in the grocery come from. Kind of piggybacking on some of that, which I think that's a health initiative. But you also have sponsored some legislation that relates to health more directly. So HB 277. This deals with school nutrition. Why don't you tell our listeners what that does, what that accomplishes, and kind of how it ties in with some federal initiatives even?
Sure. So this is one of the bills that I testified on in the interim in the MAHA, Make America Healthy Again, Kentucky Task Force. And so basically what this bill does is pretty simple. It's actually a Turning Point USA bill that they've done some model legislation on that around the country. They passed it in Arizona and California, I believe. But what this bill does is it defines ultra-processed foods, and it makes it so that anything with we list out all the chemicals, bromated vegetable oil, a lot of different other things. It just says, look, you can't serve these in Kentucky high schools. You know, if you want to still sell them at the basketball game or you want to do a fundraiser with them after school hours, you can do that there. But we just want to get that stuff out of school lunches. We don't want that being in your body while you're there trying to learn and get educated.
Right. Now, has there been like a cost-benefit analysis in terms of like the actual financial impact of this? And like I'm fully on board in terms of eating all of the stuff that kids are being fed today in schools. It doesn't teach them healthy habits for when they become adults. Let's just say that. But is this going to cost the state a ton of money? Has there been an analysis of that? It
shouldn't. I've met with the Beverage Association. You know, anybody, the lobbyists that have a vested interest in products that have these chemicals in them, and they indicated to me they're not selling those or marketing those towards schools anyway.
Good.
I met with a wonderful lady from the Franklin County schools. I'm not sure if it was Franklin County or Franklin City, but they have a scratch kitchen there, and they make all their own food. And she indicated to me the only thing that they would have to sacrifice would be Lucky Charms, which is that's terrible.
I think they'll live without that.
Yeah, that's terrible for the leprechaun, but good for the kids.
Okay.
And, you know, KDA got back to me on it. I asked them, and they didn't have any real qualms with the bill from what I could gather.
Okay. And now, how does this tie in? I know that several states have passed kind of these initiatives that attempt to take sugary drinks and, you know, ho-hos and fudge rounds or whatever off of SNAP and WIC, these government nutritional assistance programs. Mm-hmm. Is there any momentum in the legislature to do something like that in Kentucky also?
I'm not sure if a bill's been filed yet on it. I know that I have people ask me to file one a whole lot, and I can't recall if the MAHA task force testified on it. I know that Representative Proctor, who was on that task force, is very big on this issue, very much wants to see something happen there. Yeah. I think the will's there. Yeah. We have in the past tweaked or tuned up SNAP benefits to some degree. We passed last year that you had to be an able-bodied. If you were able-bodied, you had to work in order to keep your benefits or at least start looking for
common
employment.
Sense again.
So I think within the caucus there is certainly the will to do some of these things. It just becomes a matter of, can we get that to the floor? Is there a good, clean bill that everybody's had a say on?
Right. And now, to be clear, I don't want the government telling me what I can or cannot eat or anything.
Absolutely.
But when we're talking about public financing, when it's my money that is going to these programs, with your own money, go buy some ho-hos. That's none of my business. But if you're using my money to do it, or we're talking about our kids in public schools, they should basically, it's a supplemental nutrition program. So you would think that the products that they're able to buy should actually be nutritious, not just a bunch of junk food and snacks and basically someone just drinking a bunch of sugary stuff that's going to give them diabetes with my tax money, so that then I now have to pay for their Medicare, Medicaid, all that other stuff. And it all rolls downhill.
And that's consistent between the two bills. You know, the ultra-processed foods in schools, that government's directing you to that, so government can make the call on what is or isn't in there. And then on the SNAP and WIC, government is telling what you can and can't buy with that money. And so that's perfectly consistent with what you're saying.
All right. And now a second bill that I think relates very closely to this. The biggest health issues that we have in the state is basically obesity and obesity-related health problems, which spirals into cardiac problems. It also, diabetes is a chronic illness that's extraordinarily expensive for the state. And so one of the bills that you have filed also is a bill that relates to hospital price transparency. If you have gone to a hospital recently and gotten the actual bill, not the bill that you get after it goes through the insurance company, if they give you the unredacted bill, you will be amazed. And I actually do work in healthcare, so it's amazing how much the expense of healthcare from all of these chronic diseases is in the United States relative to the rest of the world even. So one of the things that I think probably is going to help is if people, when they go into those medical stays, they know ahead of time just how much money is going to be required to pay for whatever their hospital visit is or the procedure or the emergency room stay, all that stuff. So just talk to me about that bill. This is Bill 278, I believe.
I have filed so many bills that I never remember any of the numbers of. But the hospital price transparency bill, so where this came from, Donald Trump in his first term had done an executive order requiring that hospitals do this thing. He lost the 2020 election, and ultimately that never got implemented under the Biden administration. I filed this bill. I think this is the third year in a row that I filed this bill. And basically it just, and Donald Trump has since now reintroduced that executive order at the federal level to require that hospitals do this. Again, still not been implemented fully. But that's what this is. This is Donald Trump's healthcare plan to make sure that people know what they're actually paying for. It's gained a lot of momentum nationwide. The first year I filed it, we kind of just put it out there to see what would happen. The second year, John Bones Jones, so the UFC fighter, maybe one of the baddest men alive, he's actually a big proponent of this bill. He's a sponsor. He works with some national groups to help push and get this thing over the end of the line. So if the chairman of any of the committees are listening, we can have a good celebrity come in and testify on this. If you want, maybe we'll punch somebody.
It worked with Michael Kidd Gilchrist on the stuttering bill.
Yeah.
So
yeah. And so, I hope we can get this through. And what you kind of see in all these bills that I've filed is we've got to start taking public health seriously in this Commonwealth.
That's right.
We just have absolutely abysmal health outcomes, and it's important that we do something to make sure that we're doing better. When I had a job working for Governor Bevin, I was the general counsel for the Governor's Office of Agricultural Policy. And what I did is I went around and toured agricultural facilities throughout the entire state. So we gave them out money and helped them do other kind of things and projects. But what it became apparent to me is that the vast majority of the food we eat, we don't know where it comes from. And so all of this stuff dovetails together, all these bills that I've filed, to actually present some kind of a make Kentucky healthy again, a platform and a plan that we can actually address the public health crisis that we've failed to address for so long.
Yeah. Now, and I didn't pull this chart up ahead of time, but there's a chart that you can find online, and it's like since, I don't know, the year 2000 or maybe it's the year 1980, the change in cost for various services, and it's like the cost of television since that time has just plummeted. It's like you can get a 80-inch TV now for what you used to be able to get with like one of those gigantic box TVs that you could barely see in. But like the two things that have skyrocketed the most is the cost of tuition for colleges and healthcare costs. And so both of those are heavily government subsidized and regulated. And I think that's a theme. In general, when the government is super involved in regulating an industry rather than letting market forces play out, that the costs just skyrocket. And there tends to be an explosion in fraud, and we've had a lot of stories in the news recently about fraud of government programs. So I think the general idea is great. Obviously, we're talking about hospital transparency. There's a lot of negotiations that have to go on there, but the general idea is great. You should know ahead of time how much something is going to cost so that you can actually drive down the cost by selecting, somebody that can do the procedure for half the cost. We don't have that. You just go in and you get procedures from whoever wants it, and they charge you for anything that they want. And so it just doesn't work like a normal market.
Yeah, I mean, could you imagine going to a grocery store or a car dealership or you fill your cart up full of groceries and you get out there and they just tell you it's $1 million and you have no idea what you're actually paying there.
Now, both of these bills, actually all these bills, I think are common sense, but especially these health bills, it isn't at all, to me, a partisan issue. Democrats in general agree on these things just as much as Republicans. Can you talk about that, how this can be a unifying type of focus?
Well, I was so pleased watching the Super Bowl last night that I saw the commercial. I'm probably not allowed to mention that word. But, I saw that commercial where Mike Tyson came out and the RFK MAHA slogan is now, eat real food. And that's part of the big solution to this. And you're seeing the Republicans, you're seeing Democrats, everybody's glomming onto this issue because it's so critical and we've got to get ahead of it.
Right. Now, I personally think that actually these 4 bills, I would love to get certainly 3 of the 4. I think the hospital price, there's a lot of negotiations that are still left to that, so that might get delayed. But, and I'm not saying you're going to get 3 bills passed this session. That's highly unusual that anyone gets those. But I would love all these because I think as our listeners have listened, those are all just common sense things that would have a daily impact on your average citizen. So much of the legislation that comes out of especially the federal government, but even our state legislature, it just isn't clear how it impacts your everyday American. But where am I going to get the food that is going to come to my plates? Is that food going to be loaded up with chemicals and basically make me sicker the more that I eat it? Is my kid going to have healthy? Is my kid going to have healthy food? Am I going to be able to actually use some of the facilities that I paid for in order to exercise more? So I think all of those are just common sense things that both Democrats and Republicans can rally around.
All right, I'm your host, Tom Falbush with Kentucky's Voice. If you like those clips and you want to see more, click here. If you want to see the entire program where those clips came from, click here. If you want to subscribe to the channel, click subscribe below.